Hey guys, Nurse Mary back, and today I want to give another little case study about one of my clients. And for those of you who don't know me, I was a cardiac ICU nurse for 13 years in New York City, and I left the medical system to create a holistic cardiac wellness program. And I did that because mostly from the research I gleaned for myself, because both my parents died of heart attacks. And I saw that the medical system wasn't helping people get well. It was sending them off to a treatment loop of doctor appointments and medications and medication refills and side effects and more medications. And that's not health and wellness. So I created a plan for cardiac patients to heal, reverse their cardiac disease, and thrive. And I'm my own first patient. So I want to tell you about one of my clients. He went hard on a plant-based diet, and which is great. That's awesome for the heart and for your overall health. And in looking at his labs, his cholesterol is very low now, very low. And actually mine is too. I'm working on elevating it actually. Well, Mary, you're a cardiac nurse. What are you talking about? Raising cholesterol. Well, when your cholesterol's low, what does that impact? It impacts your hormones. It impacts your cell walls. It impacts your brain, because low cholesterol has been linked with dementia. So we have to have a nice balance for our chemistry, and everybody's different. Everybody's different. Their blood chemistry and their body handles things differently. And, you know, in my research, I've seen that the sweet spot is 222 to 250 for a nice cholesterol level. Well, Mary, that's over what they say. It should be under 199. Well, if you're blocking the body's ability to make cholesterol, which our liver does, our liver says, oh my goodness, our cell walls need some cholesterol, our heart needs some cholesterol. And you've heard me talk about cholesterol being the bad guy. Not being the bad guy, excuse me. So back to my client and what's going on. He now has some thyroid problems, and he was hyperthyroid. Now he's hypothyroid, and this could be fallout still from the statins he was on. He's been off them for a while, but it takes a while to get that out of the body. So, you know, what cholesterol impacts is your hormones and what's going on with your hormones as well. So the moral of the story here is, once again, that cholesterol is not the bad guy. Most people have their first heart attack with normal LDL cholesterol, and that is what statins are trying to keep down. And when you keep the LDL down, you are hurting the heart, because the muscles for the heart need something called CoQ10, and they need the fats from cholesterol. Your brain needs the fats from cholesterol. Your cell walls need the fats from cholesterol. Your hormones need to be constructed. Your vitamin D, all of it is constructed and synthesized from cholesterol. So as you can see, cutting that is not good. And we've been told have low fat or no fat diets and this and that, all that stuff, wrong. So I just want to put this upon you today, that the things you've heard or seen, more and more doctors are coming out, and I'm reposting them on my sites. More and more doctors are, and research is coming out saying that cholesterol is not the bad guy, that the food industry got involved with the medical industry way back and put seed oils out there instead of butter and good healthy fats, and seed oils were actually used as mechanical oils and machine oils, and that's being put in our body, and it causes a huge inflammatory response. And the inflammatory response causes cholesterol to go and repair the damage to artery walls. And that's where cholesterol gets blamed. But cholesterol is not the problem. What you ate and how it affected your body is the problem. All right, so that's a message for today. If you want to learn more and have more heart-to-heart chats with me, you can join my program, and I invite you to book an intake consultation with me. And we'll look at your labs, we'll look at your tests, we'll talk about your medical history and everything going on for you, because I want to know about you and meet you. And then we will develop a little plan specifically for you based on that data, and you can focus on that within my program. Sound good? If it does, book a call with me at www.speakwithmary.com, and I'll talk to you soon.